Welcome back. There have been multiple foodborne illness outbreaks this summer across the country. We're seeing some of those cases here in Colorado, like the recent Salmonella outbreak.
Here to talk about it is 9 News medical expert Dr. Pyle Coley. We're glad you're here because let's start, I guess, with Salmonella, right? How does someone get it? It's a nasty disease.
It is. It's been a tough summer, guys, with the heat, the air pollution, Cyclospora, now Salmonella. So this is a bacteria that causes a foodborne illness, basically one of the most common causes of foodborne illness. And it causes essentially a GI bug. And the way you get it is called fecal oral spread. So it's exactly how it sounds. It's contaminated food or water, usually with feces. So for example, somebody goes to the bathroom, has salmonella, they're shedding, they don't wash their hands, they touch your food. That is one way you could get it. And certainly if someone in your house has it, shared surfaces are a way to spread it. The way that it's come here into Colorado is these contaminated jalapeno peppers from Sinaloa, Mexico, which we think is not just, of course, in our state, but all over the country. And the unfortunate thing is you really have to cook the peppers in order to get rid of it, because once you get it, it really has to make its way through your GI tract.
What are the symptoms? And, you know, this is a question that I've had for a while because I ate raw chicken once and I thought for sure I was done and I watched
tartare,
myself.
okay.
No, it was just uncooked.
I see.
Not by my choice. I watched really closely to see when the symptoms would kick in, but how long after you, say, eat these jalapenos?
So think about a 6 hours to 6 days is sort of that window.
Wow,
okay, so you
window.
want to kind of keep that in your head. Yeah. Now there's two ways to get diarrhea from bad food. One is a toxin. You ingest the toxin, that comes on quickly, gets out of you pretty quickly. In this case, you're ingesting a bacteria, so that can take a little bit longer. It can last up to a week, sometimes even 2 weeks. Sometimes people are shedding for many weeks after. But essentially, they have symptoms of a bad GI bug. They have fever, they have abdominal pain, they have diarrhea. You do not want to take Imodium for this, and that is a very important message, yes. Because if you do, you shut off your gut, you shut off your GI tract, and the body's actually trying to expel that bacteria. So that can actually make things worse. Oh. And usually you don't take antibiotics for this as well. It's usually a self-limited illness. There are a few people who will get antibiotics, the higher risk people, but most of us will recover in about a week to 2 weeks.
Well, and that actually leads to my next question, because I've had, food poisoning, who hasn't? And sometimes it's so bad that I'm like, I need to go to the ER, right? Get an IV, get something, and other times it's just kind of like thug it out at home. When would you say is the best time to maybe seek medical care if you need it?
I would say if you're having diarrhea lasting more than 1 to 2 days, it's important to go get a stool test for yourself and for the state. So for yourself, because you could potentially have an isolate of salmonella that may need antibiotics, depending on how sick you're getting, and it may be resistant to antibiotics. We've already seen isolates come out in this outbreak that are resistant to antibiotics, but also for the state, because we need to know what's happening with the salmonella. So in a couple of days, if you're having a lot of diarrhea, not able to keep, food and liquids down, for little kids, you definitely have a lower threshold. More than 4 days of diarrhea, you got to take them to the pediatrician. The people that we would treat with antibiotics are kids under the age of 3 months, usually older adults, 50 and older with heart disease, 65 and older in general, HIV, cancer, pregnant women, the usual kind of high-risk groups we would treat. But you may be someone who might require treatment depending on what your doctor thinks.
At the beginning of the summer, midsummer, we were keeping our eye on lettuce, and now we're looking at jalapenos. What if we have them in our refrigerator, or going out to pick them?
Yeah, fresh jalapenos, probably throw them out. When in doubt, throw them out, because we don't know where they're coming from. Now, if you can prove that they're not coming from Sinaloa, Mexico, it might be okay to eat them. Washing them does not get rid of salmonella. In fact, it lives in those crevices. Soaking them in vinegar, using produce brushes, none of that gets rid of it. The only ways you can get rid of it is by cooking it at high temperature, so 145 to 165 degrees. Those pickled jalapenos are usually okay if they're processed, pickled, cooked, because that usually doesn't cause salmonella. It's really that fresh produce that we're worried about. I was going to order a jalapeno sandwich the other day at a restaurant.
Wait, a jalapeno sandwich?
Well, with I'm a vegetarian, so with the fake meat, it makes like a jalapeno burger. Yeah,
But you chose not to.
I did not.
Yeah, see,
because
now I'm not cooking anything at high whatever. I'm just staying
agreed.
away from all the things people are telling me to stay away from until.
Right. And it's hard to know.
Back.
Like if I ask you 6 days ago, did you eat a jalapeno that might have been contaminated, or lettuce or cilantro? Because we also have Cyclospora at the same time. It's difficult to know. So when in doubt, go see your doctor, get a stool culture that'll detect both cyclosporiasis and, salmonella, and then we can decide whether you need antibiotics, because for cyclosporiasis you do, for salmonella you don't.
Oreo cookies are good though, right?
I was about to say, I'm going to have pizza.
Those do not have salmonella.
Okay, perfect. Thank you, doctor. I appreciate that.
Play it safe,
More Oreo cookies and
everybody.
pizza.
All right, Dr. Coley, thank you.